Welcome to this special interview on the personal side of medicine, offering a unique perspective on the values and principles that have shaped the person who wears the white coat. I'm joined by a distinguished doctor who's dedicated his life to healing. Thank you so much, Dr. Lee, for joining us and sharing your personal side.
Oh, thanks, Christina. It's a pleasure to be here.
So, what inspired you to go into medicine and then urology?
So, my father is a urologist. So, that obviously made it kind of front and center as far as career possibilities. But as I got a little bit older, people would ask me what I wanted to do, and I would just always say, "Oh, I want to be a doctor." But then, so then I went to college, fortunate enough to get into medical school, and I always like working with my hands. So then I definitely wanted to do some sort of surgical field, but urology was one of the last things that I wanted to do. Yeah, just because of the area of the body, when I was a kid, I didn't think, oh, that was all that appealing. But as I went through my different medical school rotations and saw different fields, I saw how great a field urology is. And so it was really attractive. And then I was fortunate enough to get a urology residency. And so, that's how it all started.
So, what hobbies or interests do you do that influence the work you do?
I think those things are all really good stress relief for me. Practicing medicine can be very stressful and time consuming. So I've always been a really big sports fan. So growing up, I played baseball, pick up basketball, and then got into playing tennis. But then my real kind of passion now is playing golf. And so I'm a golfer and try to play as much as I can. But I really love the game because it is for really obsessive compulsive people because it's a hard game. And so it does distract me from like thinking about something else. And also being outside. Living in Southern California now, the weather's so beautiful, and I've heard it said that nature is not more beautiful any place except a golf course. And so I think in some ways that's true. And so it's a great game, but it really gets me away from kind of my normal work schedule for a while.
So, what personal experiences have you gained through your work that have influenced your worldview or your personal value?
Yeah, and, that's a great question. I think the life is a constant process of growing, learning, but I think in the end of it all, it's really about the relationships that you make with people, which are really the most valuable. And so, one of the wonderful things about being in medicine is the idea of mentorship. And so I've had great mentors in my career, including Dr. Clayman, who started our Department of Urology here. He's a truly innovative leader, but one of the things that I love most about Dr. Clayman is what a genuinely authentic person that he is. And so he's a really inspiring leader in that way. But also the relationship that I've built with patients over the years has been super valuable to me. And one of the ways that it's impacted me is I have a lot of patient friends who are golfers. And so I was able to visit and play at many of the very famous courses across the United States because of my patients. And so I'm very grateful to them for that experience.
It's so sweet of them to invite you.
Yes.
What is most fulfilling and motivating about the work you do?
Yeah, the most fulfilling things about being a doctor, I think, is really taking care of patients. When patients come in, especially for what I do, when they have prostate cancer, it can be really scary. And so trying to identify with them on their side of it is, I think, very humbling to think about. And so, trying to spend as much time as I can so that patients understand what prostate cancer is and whether it's going to impact their lives and how treatment is going to impact their lives, and having them really get a feel for it, and then building that relationship so that if they do decide that they want to do surgery for treatment, that they feel comfortable with my experience and what I've done. And then seeing patients through that difficult experience of surgery and the recovery and having them have a good result, and then seeing that they are actually really thankful and appreciative of the work that I do. There's nothing better than that. So it really is very special and a real privilege to serve in that role.
So, what do you believe are the most important technical and personal skills for a successful urologist to have?
Yeah, I think there's a reason they call medicine practice. So there are these technical components, including skill in the operating room and experience, which really helps patients to have a better outcome. But the the art of medicine is, I think, even more important. And I think a lot of that comes from understanding where your patient is and understanding that we as providers are going to be patients someday too if we're not already. And being able to build that connection and have people feel like they, again, understand and feel comfortable with what we need to help them with, I think that is probably the most important thing that we can do as healthcare providers.
Well, so you sort of touched on this already, but so how do you cultivate these important skills of effective communication and building of trust between your patients and their families?
I think it's so important to listen to people. It is something that I think a lot of people don't take time to do, especially in our busy work, not only in medicine, but everywhere in life. I think we get too busy talking at people rather than listening. And so that ability to hear and really get what people are saying and where they're at is extremely important. And no matter what situation that you're in, whether you're in a doctor's office or an airplane or a checkout line or wherever you are, when you're faced with interactions with people, which can both be really uplifting but also difficult from time to time, the listening part is such an important skill, which I'm still trying to get much better at. But I think we can all get better at it. And if we do, I think it would make the world a better place. So I think that communication, both that listening part, but also being able to speak in a clear manner that's understandable and relatable, I think that's super important. And that takes time. If you don't spend the time to make sure that everybody has a common understanding of what's going on, then you haven't completed what you need to do.
How do you address then patients' hesitations or concerns about seeking your care, especially prostate cancer?
Yeah, I think there are a lot of stories out there about men in the past who've had treatment for prostate cancer, whether it's radiation or surgery, and what difficult times that they've had going through these diagnoses and treatments. And so I think we've gotten a lot better these days, especially in the past 10 to 15 years about how we treat men with prostate cancer. It's not only about surgery or radiation, but we do a lot of surveillance for men with prostate cancer now, given that they have the appropriate type of Gleason score and type of cancer cell. And so understanding that there are options, but they're not always the most difficult options, can be really helpful to know, and just having a general overall better understanding. And again, that comes down to that communication factor. Taking the time to really listen and explain, I think goes a long way in order to helping guys feel more comfortable about what's going on.
How are you involved with and preparing for the changes coming to the field of urology?
I think working here at the University of California, Irvine provides us with a wonderful environment in order to be ready for change and, in fact, be change leaders in the field. We have physicians in our department who are leaders in all the different subspecialties of urology. And they're always thinking about better ways that we can treat patients in a more minimally invasive fashion. And this has been our historical precedent that we're always looking for and providing the most minimally invasive, which means fewer incisions, smaller incisions, quicker recovery time, back to all your normal activities as soon as humanly possible. Um, these changes are in a large part actually led by urologists. There's so many great technologies that have actually come about as a result of the work that urologists have done to pioneer these changes. And I feel like we just have such a wonderful group of physicians here that I'm privileged to work with.
Well, you're one of them. Your dedication to your patients and profession is really inspiring. Thanks so much for sharing your personal side with us.
Of course, Christina, thank you. Thanks for the opportunity.
Let us all take a moment to reflect on the values and principles that drive our own lives and the impact we can have on the world around us. Until next time, this has been a special interview on the personal side of medicine.